The most important thing for all residents is to make sure that they have some type of health coverage by March 31st, 2014. That is the drop dead deadline to enroll in the health insurance marketplace.
What happens after the drop dead deadline?
After that, there isn't another open enrollment period until November 15th. And so they would be completely uninsured during that time frame, and they would be assessed a penalty of either $95 or 1% of their income, whichever is greater.
How does that happen? On your income tax?
It is assessed through the tax process based on the information that's reported to the IRS. We haven't seen them go through the process of penalizing someone, so we'll all be learning as we go through this with our navigators, our certified application counselors, and our community residents. But the most important thing is making the investment in your health right now and getting the health care coverage as opposed to paying a penalty, remaining uninsured, and then having to deal with those hospital bills that you would be responsible for.
1%, that's a lot of money for some people.
It can be, absolutely. That's why the important message is to make sure that they get covered by March 31st if they don't have any insurance currently.
What do people need to do then? What do they do between now and the 31st? How are they going to take care of this?
So between now and March 31st, there are a couple of different options. If somebody wants to work on this all by themselves and they feel comfortable purchasing insurance for themselves or their family, they can go onto healthcare.gov and do that by themselves. But if they would like to work with a community assister, a navigator, or a certified application counselor, they can actually call 211, which is First Call for Help. The United Way's First Call for Help service is available 24 hours a day, 7 days a week, and they can help residents find a certified application counselor or navigator close to their zip code. And those are folks who can actually help people go all the way through the application process, understand how to apply, what the enrollment process actually is, whether or not you qualify for a subsidy, and then compare the plans that are available to you in this area to make sure that you're choosing the best plan for yourself and your family's health needs as well as your budget.
So there's a lot of people out there that don't have internet access, they don't have computers, so they would call 216,
211.
And that person would take them from top to bottom and get them enrolled, or do they
No.
just tell them how to do it?
No, that person, when they call 211, that's the United Way staff who knows where all of the application assisters are in the local community, and they can help them figure out, okay, it looks like a CHAP navigator is going to be over here in this neighborhood for you. Let's get you connected with that individual so that you can get scheduled for an appointment with them to sit down and go through the application process.
And actually do it.
Yep. And it takes about an hour to sit down through the application process with a navigator or a certified application counselor. But that takes somebody all the way through the process of getting their registration started. If they don't have an email account already set up, we can help them get an email account set up, go through the application, and then look at the plan options. And that's really the part that takes the longest. So if someone knows that they've got specific health needs, that's one of the pieces that we want to make sure they understand what their health needs are, what doctor's offices they'd want to take advantage of, whether or not they need to make sure that they get prescription coverage for certain types of medications, and those assisters can help them with all of those really important details of a plan selection.
Great. What are we doing here tonight?
Tonight we're talking to the residents in this area and the congregants of the church to make sure that they understand what their options are. And then later on we're going to be working with some of our community partners to make sure that we can get in and work with folks in a computer lab in this area to get them connected with navigators or assisters and take people all the way through the application process on site.
Are little community meetings like this happening all over the country?
They are. They're happening all over the community, all over the country. This is some of the best way to talk to residents and make those connections and figure out who really does need help in a one-on-one setting and make sure they know that there's local help available to them.
What are you hearing about these people? Why are they waiting to the last 15 days to do this? What are you hearing back?
You know, it's people that got started on the website and then didn't go back and finish for whatever reason, or they got started and they realized that maybe they were in over their head. If you haven't purchased health insurance at all for yourself or for your family, it can be a very intimidating process. And so we want to make sure people know and understand exactly how insurance works, what the different terms mean, what it means to have a premium and a deductible, and those out-of-pocket costs. So for a lot of people, there's a lot involved, and they've had to go back and really think through their options.
Finally, just make a plea to people. Why should they do this before the end of the month?
It is so important right now in this community to make sure that you have health coverage of some type. This is for your health, and it's an investment in yourself and for your family. Otherwise, you could be faced with a financial situation that could be absolutely devastating for you and your family. And instead of being faced with that situation, this is an opportunity to have health coverage that actually allows you to take care of yourself and your family.